Hi everyone, welcome back to our audiology series. If you are considering or about to start audiology school, today's video is for you. I will cover everything you can expect in audiology school, from the coursework and clinical experiences to the networking opportunities that can open doors to a great career. If you don't know about me yet, my name is Sema Yalçınkaya. I am an ASHA certified audiologist. I was previously an international student from Turkey while I was doing my Doctor of Audiology program at Gallaudet University. I am also the founder of American Expert Academy. If you are curious about my website, you can check the link from the descriptions. Let's dive into today's topic. First off, let's talk about coursework. Audiology school requires a mix of foundational science classes and specialized audiology topics. You will encounter subjects like anatomy and physiology, especially focusing on the ear and auditory system, audiology assessment, where you will learn about different hearing tests and diagnostics, auditory rehabilitation, which involves techniques for helping those with hearing loss regain communication abilities. Courses can be intense, especially as you move into clinical and advanced subjects like auditory evoked potentials, vestibular testing, and amplification. Expect to dedicate a lot of time to studying and projects. Most programs also include courses in research methods, as understanding research is essential to practicing evidence-based audiology. Something I found helpful was setting up a study group with my classmates. Audiology is highly collaborative, so learning with others can enhance your understanding and make studying less isolating. One of the most exciting aspects of audiology school is the clinical experience. Most programs start with simulated or observational experiences where you will learn to use audiometers and other essential equipment before working with actual patients. As you progress, you will take part in clinical rotations at hospitals, private practices, or university clinics. This is where you will apply what you have learned in the classroom to real patients, performing hearing tests, fitting hearing aids, and conducting vestibular assessment under supervision. Clinicals give you a chance to see how each specialty like pediatric audiology or vestibular testing works in practice. In my own experience, my clinical rotations were invaluable. Working hands-on really helped me grasp complex concepts and understand patient care. You get a real sense of how to work with different age groups, and you begin to see the impact you're making. It's a rewarding part of the program, and it's where many of us truly fall in love with audiology. Audiology is a close-knit field, and networking plays a huge role in building a successful career. Most programs offer various student organizations like the Student Academy of Audiology, which is a fantastic way to connect with others who are also passionate about audiology. Conferences are another key networking opportunity. Professional conferences like the American Speech Language Hearing Association Convention, the American Academy of Audiology Conference, or the Academy of Doctors of Audiology Conference are perfect places to meet established professionals, potential mentors, and even future employers. Or for those interested in specific areas like vestibular audiology, more specialized events like the American Balance Society Conference can provide tailored networking and learning experiences for you. Networking really helped me. At my first American Academy of Audiology conference, I met several professionals who gave me valuable advice on navigating my clinical rotations and even introduced me to potential externship sites. These conferences are not just about learning, they're also about connecting with people who can support you and whom you can help in return. So I remember going to American Balance Society conference, and it was much smaller conference than others, and I was able to talk to many people at that conference, and I found a researcher who actually do similar research to mine, and I was able to engage with him and ask him a lot of questions. I made a lot of friends from different conventions, so I really give a lot of value into these conventions because they are great ways to make connections and even find some job opportunities in the future. Audiology school is challenging and can sometimes feel overwhelming with its mix of academics, clinicals, and professional development. Finding a work-life balance is essential to avoid burnout. Many students find it helpful to schedule regular breaks and self-care activities like exercise, hobbies, or just time with friends and family. Also check in with your professors or program advisors if you are feeling stretched thin. They often have advice on managing coursework or can suggest additional resources for support. Tip: schedule some downtime each week to recharge. Audiology school is a journey, and taking care of yourself will make you a better clinician in the long run. Aside from audiology-specific knowledge, you will build other critical skills during audiology school. These include communication skills for explaining diagnoses and treatments to patients in a way that they understand. Empathy and patience, as working with patients requires understanding and supporting people through potentially challenging experiences. Research skills, particularly if your program includes a thesis or research project. These help you critically assess studies and integrate evidence-based practices into your work. I can't emphasize enough how important these additional skills are. Audiology is not just about understanding sound waves, it's about making a positive impact on people's lives. Learning to communicate complex information in a simple, supportive way is invaluable, especially when working with patients who may be experiencing hearing loss for the first time. That's a glimpse of what to expect in audiology school. It's a challenging but incredibly rewarding journey. From mastering coursework to building clinical and interpersonal skills, each step is a building block for your future career. In the final part of this series, I will share my insight on finding externship and jobs in audiology, including tips on the job search process and what employers look for in new audiologists. If you don't want to miss it, make sure to subscribe and turn on notifications. Thank you for watching and best of luck on your audiology journey.